we live in Boston in Lincolnshire, is full of Polish people. And they don't speak much English, but they are the nicest people, really, around, yeah.
Hello, I'm Harry, 16, and this is my first time in Poland.
Hi, I'm Sandy, and I'm 60. This is my first time in Poland.
Well, last year I went into hospital for an infection underneath my skin, and I also found out that it was part of an issue was I had an inflamed liver due to my obesity, and as well as just feeling horrible all the time about just general things that I can't do, running, like all the other activities a normal kid should do. It's really like depressing, and it gets down. So it's just coming here is something that I've wanted to do since I've known about it.
Together we looked at many different places, and we found that the communication, the English communication, was the best with the KCM Clinic. The coordinators, who we've been talking to all the time, have been very understanding and answered every one of our questions. Even if Harry's emailed her, you got all your questions answered, didn't you?
It's been a steady pace, and it's been really easy to transition into it.
Yeah.
It might sound a bit boring, but just being able to feel lighter is just a thing that's going to be nice. It's going to be nice to be able to have a bounce in my step again, I guess.
Yeah. Find clothes that are suitable to fit in.
A new wardrobe would be nice.
Yeah.
The KCM Clinic, they're so good because you can ask any question. If you have a question, there will be a response to it. So I wasn't feeling too unprepared for anything. Maybe apart from the recovery process, since this is my first operation. That was the only thing I could have been unsure about, and it's been perfectly fine so far. I've been up and out the past 2 days, walking about, and it's been fine, been normal.
It's expensive in UK, and that's the initial, for two of us, that's the real reason why. I had my band in UK, which was, it was okay, but I found I was on a conveyor belt. I would be there early morning, I had the operation that day. The following morning I was up and gone by 7 AM home, and it just was, I felt uncomfortable and I felt poorly. I didn't need to go home that day, I needed to stay there.
And everything here is very customised patient to patient, and it feels very direct. So you're not getting any of that like production line kind of healthcare, and you can say what you need to say without it being too much of a delay to yourself or anybody else.
Yeah, everybody from the coordinators to the nurses to the blood test to the people who do the COVID has been absolutely wonderful. Even the COVID lady's been laughing today, calling us wimps. Absolutely, I am coming back. I know that because I paid for it. But I'm not sure whether I'm going for the sleeve or the bypass now. I need to think about it and ask the surgeon in January when I start speaking to him again. And
definitely do your research before coming here and getting what you want, and so you know what's going to happen. Just make sure you do your research and everything will be smooth, because that's how it's gone for us.
But we'll definitely recommend you, KMC, yeah.
Perfect. It's KCM, but that's fine.
KCM.